Hello, good day. I'm Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, I'll be as a part of the CME program on a health awareness program on different topics. And the topic I'm dealing now is on the facets of epilepsy. This is part 3. Part 1 and part 2 are over. Part 3 is how will you diagnose epilepsy? It's a common question that arises in the mind for every doctor. How will you diagnose epilepsy? One of the most important things which you have to understand is when a person has a fits. Now, one single fit is called a seizure, okay? A sudden irritation of a group of cells in the brain, and that produces some manifestations, motor and sensory, for the body. So that is one time it is called seizure, but when it repeats, it is called epilepsy. Now, how will you diagnose it? This person has got epilepsy. So for that, you should know the various types of epilepsy. That's very, very important. Various descriptions, the various types of epilepsy is very, very important. Of all the epilepsies, there is only one epilepsy where the patient will come and tell you, yes, I had this. And that is a partial or the focal epilepsy, which arises from one portion of the brain, and then what you can say, you have a twitching and the patient is fully conscious and aware about it. All the other forms of epilepsy, the patient is not aware about it, be it complex partial seizures or simple or complex going in for generalized, then absent seizures, tonic seizures, clonic seizures, tonic-clonic seizures, myoclonic seizures, atonic seizures, akinetic seizures. In all these, the patient is unconscious. They do not come and tell you. Only a person who has seen it will come and tell you, yes, this is what I saw. Based on that history, we have to diagnose epilepsy. So taking a careful history is a very, very important thing in diagnosing epilepsy, after which you perform a detailed neurological examination. So even after about you do CT scan, EEG, MRI and all that, around 10 to 20% of them, all these things will be normal. Therefore, if you want to diagnose with confidence, that is only the history will help you. That too, a person who has seen it, a witness who has seen the episode will in fact tell you the features, what he saw. He will explain it in detail, or rather the doctor should get the history in detail, and then only one can diagnose epilepsy. So the most important step is taking a very careful history. Perform a detailed neurological examination. A careful history is worth more than a battery of tests if one is to avoid the serious mistake of making a wrong diagnosis. Very, very important. The moment you make a wrong diagnosis, what happens is you prescribe anticonvulsants, which they have to take for more than a period of 5 years, and they got to keep monitoring. All those things are there. So many aspects follow. Even the lifestyle will change. So therefore, one has to be extremely careful in diagnosing, and one has to rely on the history. That's in brief on how to diagnose epilepsy. Thank you. Thank you very much.